Good afternoon. I'm Linda Goler Blount, and I'm the president and CEO of the Black Women's Health Imperative, and I'm excited to welcome you to another edition of Black and Well TV. For over 37 years, the Black Women's Health Imperative has worked to improve health outcomes for Black women through research and evidence-based programs, by ensuring that Black women are centered in policy development at both the state and federal level, and by providing resources and information to help the everyday Black woman make the best possible decisions for her health and wellness. As our nation and world work to navigate an ever-changing global pandemic, we are here to provide Black women with information to protect themselves and their families, but also with the hope and support that they need to just breathe. As the impact of COVID-19 continues to spread, our communities are doing their best to adjust. Women and families are forced to balance work and school and life, and each week that passes seems to shine a very bright light on the inequalities and challenges within our health communities and our society in general. In 2019, the Black Women's Health Imperative launched the Positive Period campaign, which is focused on addressing menstrual product insecurity, or what is more widely known as period poverty. If you've never heard the term before, it refers to the inability to afford sanitary products and the lack of menstrual education. Many of you are aware of the issue, but believe it only occurs in developing nations. However, a 2019 survey conducted by researchers at St. Louis University revealed that 2/3 of low-income women in the area could not afford menstrual products at some point during the year, and school-age girls miss 2 to 3 days of school each month. That amounts to about 1 month out of the school year, enough to derail their education chances and for college and for career. So what does that have to do with COVID-19? We're about to find out. We have 3 dynamic speakers who will join me in shedding light on this important issue and how it has been amplified because of COVID-19. We'll begin with the founder of the Black Women's Health Imperative and lifelong activist, Byllye Avery, who will give us some history of BWHI and how it began and its focus on reproductive health and justice. Next, we'll talk with Tanisha Boswell, founder of Black Moms blog, about addressing some of the stigmas associated with menstruation. And then we'll close out with Dr. Angelica Ferguson, the Chief Health Officer for the City of Atlanta, who will talk about solutions to pressing reproductive health issues that women in Atlanta are facing. So let's get started. As we bring Byllye on, I want to remind you that this is an interactive experience, so we'll be taking questions and comments throughout the broadcast. Please use the Ask a Question function located at the bottom of the screen or the chat function to the right to send us any questions you might have. So welcome, Byllye. How are you?
I'm great.
Oh, good. I'm glad you're great.
Yeah.
How are you dealing with COVID-19 in Provincetown?
Well, we're staying inside, which is and obeying all the rules, and realizing due to age and a lot of other factors, I'm in the high-risk group. So I'm not taking any chances. So I'm doing everything we're supposed to do. And really, it's quite all right. You know, I'm fine.
Well, good. I'm glad to hear that. So to start, would you provide a little bit of historical context for the people who have who are watching about the Black Women's Health Imperative, sort of how you decided to establish the organization on Spelman's campus, and sort of what your intent was and what that means now in this era of this pandemic?
Well, we got started in 1983, actually a couple of years before that, when we planned the first national conference on Black women's health issues at Spelman College. And we thought we'd have 200 to 300 women come, and we had over 2,000. And so after that, we really were under the banner of we're sick and tired of being sick and tired, and feeling that the answers to a lot of our health problems were inside of us, and that we needed to make our perspective known as how we viewed health issues and how we thought these issues should be addressed. So one of the first things we did, we spent a lot of time on psychological well-being. We broke the conspiracy of silence. Most of us had never talked about things that were happening to us. And so that brought out a wealth of information as well as an affirmation that yes, these things are happening to you. No, you are not crazy. And it included anything all the way from racial discrimination to the negative things that happen, sexual abuse. We had abortions, we were having babies, all of the things that affect our lives. And at some point, I think around 1985, we started having a discussion with mothers and daughters about menstruation and how do we talk to our young girls, and how were we talked to, and what were we told. And as a result of those conversations, um, we talked about making the film. So we made On Becoming a Woman, Mothers and Daughters Talking Together, which was the first film that we know of, and certainly the one that had Black women talking openly about menstruation, about the negative parts of it, and talking about how important it is for us to claim our bodies and claim all of who we are. And that started our work and led up to the issue that we're talking about today. We didn't know about period poverty at that time. I guess probably some of it did exist, but that wasn't in our awareness at that time. But what COVID has brought about is an understanding of just how expensive it is to buy menstrual products, and how in many states they're taxed, they're considered luxury. Well, menstruation is a normal body function. We have no reason to be ashamed of it. We have no reason to feel bad about it. We have no reason to make any excuses of it. It is what makes us a woman. And it is a great source of power. And if we're going to love ourselves and take care of ourselves, we have to claim that part of it.
Yeah, and it sounds like we need to do that, especially now during this crisis.
Absolutely.
But I want to dig a little deeper into the Positive Period campaign. You've been a key supporter since the beginning. Talk a little bit about why you thought Positive Period and the issues of mental insecurity are important to the Black Women's Health Imperatives mission.
Okay, well, I really got turned on, inspired, made angry, whatever the feelings were, when this 14-year-old girl in Kenya killed herself because she got her period at school. She had no idea what it was. Her female teacher shamed her, and she hung herself, not knowing what's happening. And it just struck a nerve, that it's time for us to confront these negative attitudes about a normal body process. It's time for us to make sure that we provide menstrual products for everybody. This is not a luxury. This is something that we absolutely have to have. And we have companies that provide Viagra for men so they can have sexual pleasure. And I'm telling you, women need menstrual products. And if you take a family with 3 or 4 girls in them, and you know how in the house everybody gets their period at the same time, you females, in a matter of time, everybody comes on at the same time. And if you already having trouble making ends meet, you have difficulty buying these basic products, and they need to be made available. They need to be free. They need to be where you can get them. And in that process, we need everybody to stop the negativity around menstruation, the negative talk, all the names is called the curse. I got my Aunt Flo is with me, and it's all the negative connotations. And if you're gonna love yourself, you have to unlearn all of that. I personally had to unlearn it because I had a painful period. I missed school, I soiled my clothes, all the things we as women go through. But if I was going to access the core of my power, I had to claim my period. I had to change my attitude about it. And in that way, when I changed my attitude, I was then able to change the attitude of my daughter, of her friends around her, and of other women. So we model that behavior. And when we do that, we can get rid of this.
So you just said a lot. If you were going to distill that down, I mean, I've talked to, obviously hundreds of women who have talked to you, or thousands have heard you speak. And they always tell me how inspired they are. But if you were to distill all of that down to one or two things that you want to make sure that Black women do, particularly as they're navigating COVID-19, what would that be?
Well, you're in COVID-19 right now. So you're all locked up in the house together. I say to the mothers, share the stories of when you first got your period with your family members. That's the first thing. Because you already might have a daughter who has a period, or you might have one that's coming up, and you're going through all the anxiety that we mothers have. Oh my God, they have a period, they're going to get pregnant. I got to talk to them about sex. I got to do all that. Yes, you do. Because young people, our children, want to hear about sex. They want information from our parents because they trust us. And we need to set a model of how we talk about sex and sexuality within the family, so that then gets passed down generation to generation. Because you can talk about it with feelings. And of course, they're going to ask you a question that's going to make you feel uncomfortable. What you do is say, okay, give me a minute. Let me think on this, and I'll come back to you and give you an answer. The best thing is to be honest. The best thing is to be honest. And you don't have to worry about it if you are honest. And it establishes a relationship, a closer relationship between you and your family, the daughters and the sons. The sons need to know about it. We had a big birthday party when my daughter got her period, and all the kids sang happy birthday and happy menstruation. We had a cake, and her brother was there, and I talked about this was a positive part of her life. So that will go on for generations in our family. That's one of the best gifts you can give.
Well, thank you, Byllye, because that I think sets the stage for our next speaker. I want you to stand by because we're going to bring you back. But I want to bring on Tanisha Boswell, who has talked about stigma around periods and runs a mom's blog.
Hi.
So that was a perfectly wonderful lead-in, Shanicia. And let me start with, how are you doing?
I'm doing amazing. How are you?
I'm doing okay. Yeah. Even with all of this, I'm having a moment of doing okay right now. So you heard what Byllye said. You also celebrate periods.
Yeah.
So tell us about the period party that you hold, and what the inspiration was behind it, and even if there's things that other women and communities can do around the country.
So first, I just want to say thank you to Byllye, because you're right. I was listening to her talk, and it just literally invoked a saying to everything that we do at Black Moms Blog as it pertains to menstrual health. So for Black Moms Blog, we have a period party every year, and we do it to collect menstrual items for women at homeless shelters here in Atlanta. And the thing is, when it comes to homelessness in our country, there are over 500,000 people that are homeless. They say about 40% of that are women, and then of that 40%, another 40% are Black in general, of the whole homeless population. And so a half of the period party is to collect donations for those women in the shelters, because a lot of times we give things, we give clothes, we give shoes, we give, tissue, but you forget about periods, and women are having to choose between their menstrual health and food. And just like Byllye was saying, like, that shouldn't have to be a choice. The other side of the menstrual drive and the period party is to bring awareness to young girls, especially, to help them to embrace their cycles. And just like she said, a lot of us growing up, we didn't have any idea about our cycles. I remember being younger and my mother handed me a pad and sent me off to the bathroom. And, so we learned a lot about our cycles from the little, pull out in the tampon pad box of the woman showing you, putting it up, and you just didn't know anything. And so as the mother to a daughter, it was important for me to start this, to teach her about her cycle. And just like Byllye said, taking away the stigma and the shame surrounded around menstrual health. I'm going to post something in the comment section. It's a video that I made with my daughter, and it's called "What is a Period?" And she's 7 years old. And on my platform, it was just important for me to sit down and talk to mothers about why they need to be having this discussion, not just with their daughters, but also with their sons around menstrual health.
So this is really important. And you mentioned the women that you are supporting, and I'm thinking about these congregate facilities, shelters, spaces where women are in numbers, prisons, where they can't socially distance. Have you heard anything from any of the folks that you work with about what menstrual insecurity is like, or menstrual supplies are like in those kinds of settings? I've not heard anything. Are you hearing anything?
I haven't heard anything as related to COVID, but in general, when you're a woman and you have your period and you don't have a pad, there's an odor that comes with that brings a lot of insecurity. They're having to use t-shirts, socks, paper towels, newspapers. But overall, the uncleanliness that comes with not having the proper care to take care of your menstrual cycle. I mean, it's one of those things where we don't necessarily have to hear anything to know. Just, we're in the comfort of our homes. We have hot running showers. We have clean clothes, clean underwear, menstrual products. And even still, it's such an uncomfortable time of the month. And imagine that not only with the physical well-being of your health, but also the mental that comes with having on your hormones and the emotional roller coaster, putting that on top of a woman that already is homeless. And a lot of times homelessness is due to mental health issues anyways. I mean, I just can't imagine what that has to really be like. So,
yeah. So you're starting with your daughter young. So just destigmatize, demystify, not make it a big deal. It's a normal part of our lives. It's something to be celebrated. What are 2 or 3 tips or recommendations you could give mothers or big sisters, aunts, about communicating with young women in particular about their periods?
I think that the advice here is more than just related to menstrual cycle, but as it pertains to our periods, we have to open up the vessel of communication with our children. I think as parents, a lot of times we want to talk at them and not talk with them or talk to them. And a big lesson I've learned as a mother is that if I just sit down and ask my daughter a question, she'll tell me what she thinks about it. And so for a lot of moms out there, when it comes to their periods, they may think, oh, my daughter doesn't have any idea what that is. Sit down and just ask, hey, do you know what a period is? Do you know what mommy's in the bathroom? And, kind of open it up in a question form. First, figure out what it is that they know. And then from finding out what it is that they know, leading it to a proper and healthy discussion. Because the overall goal here is for our daughters to feel open enough to talk to us about hopefully everything. But when it comes to their period, I know this last menstrual drive, I went and I talked and I surveyed a lot of moms and asked them about their experience growing up. And I can't tell you how many times I had women tell me that they had their cycles and didn't even tell their moms for months. And I can't even imagine, so when it comes to my daughter, I constantly have the conversation with her. She's seen pads. She's seen tampons. She's seen Diva cups. I've had her in the bathroom showing her what it is. And I've explained to her that because she's 7 and a couple of years, she's going to have a period. This is what she should do. And then also with moms that may have daughters that are a little bit older, go ahead and create that care package for them. Put one in their bedroom, put one in their book bag, put one in the car. Put one in spaces where they're at, where this could happen so that they're properly prepared. And in those care packages, they should have a change of underwear. They should have a pad. They should have a piece of chocolate. They should have a little, an encouragement card from Hallmark or something that's telling them that this is something to be proud of, because our menstrual cycles it's a blossoming into womanhood that should be celebrated. It should be a celebration and not something that we're afraid to talk about.
Yeah. Some people have said, well, it should be a non-event, but it's not a non-event. It is something to be celebrated.
Yeah, it's a huge event.
So will there be another period party this year? Have you already had it for 2020, or are you going to do something special for COVID-19?
So for COVID, we just had our period party at Mental Drive in February.
Mm-hmm.
And so I'm actually thankful for that, because we collected, I believe it was like over 1,000+ items that we dropped off at the shelter right before this hit. And it was so many products. And so in my mind, I'm hoping that, the women that are going through the menstruals now still have some of those items. But we do the period party in the menstrual drive once a year. We did it this year in February. It's normally held in December, so I'm still trying to figure out if I'm going to do it in December this year or do it in February next year, but we do it once a year.
Okay. Well, Shanicia, thank you. Stand by, because we're going to bring you back, and we're going to kind of drill down to the city of Atlanta. I want to bring on Dr. Angelica Ferguson, who's the Chief Health Officer, to talk about what's happening in the city, and to kind of give us some highlights on or insight into what COVID-19 means for residents in Atlanta. Angelica, hi, how are you?
Hi, every time I see you, it just brings a big smile to my face.
Same here. I'm happy to see you smiling. As a Chief Health Officer for the city, I can't begin to imagine. What have you given up, sleep or food? Which is it?
It depends on which day and the time of the day. It happens at the state level. It just varies. Stay home, Santa, please.
Well, so let me start with this. You're the first ever Chief Health Officer for the city. So you kind of got your work cut out for you. Well, what kind of vision have you set for your team, particularly around women's health for the city? And, given where we are, how has the pandemic sort of amplified what you have to do?
So just to give a little context for everyone, when you say I was appointed as the first Chief Health Officer, she really does mean the first. In the history of the city of Atlanta, local government, there was no playbook. When we were establishing plans and initiatives, we really were starting from the ground up based on the guidance from our mayor. She really established a One Atlanta equity lens. And so initially our focus was around HIV prevention and treatment, focusing on PrEP. And how do we ensure that women have knowledge about PrEP and getting access to those services? We really wanted to, as you know, we partnered with BWHI to focus on mental health in women. And we hosted the very first emotional wellness summit for women, again, back in February, right before COVID-19 hit Atlanta.
Seems so long ago.
I know. And we planned it in a very short time. Go in, Monica, Linda. And during that time, we also wanted to focus on a very comprehensive approach around healthy eating and active living. So it was very well-rounded, very public health centered, with a combination of sexual health and reproductive health, a little bit of maternal and child health as well. And so there were a lot of plans that we were establishing, a very clear vision, a very clear mission. And then within the first 6 months of me being in this position with no playbook, a pandemic hit the entire world. And it hit Atlanta very quickly. And so it shifted everything that we wanted to do and how we wanted to do it. It shifted our timeline because by the time, right after the Emotional Wellness Summit, we had to figure out how do we keep residents and citizens of Atlanta safe. Were we going to implement the order to stay at home, a shelter in place? How do we do that? What do we need to do? And what do people need? And so still using an equity lens, it went from addressing these very specific health topics to understanding how our most vulnerable populations, especially women, are going to be impacted during this moment. We know that Black women are more likely to take on essential jobs and other jobs that don't allow you to work from home. And so we implemented certain policies, and we can talk a little bit about that later to kind of curtail the impact. But that's how everything shifted when COVID-19 got to the United States, because we started early as well.
Yep. Yes, you did. So with, what's going on now, what are some of the most pressing reproductive health challenges that you feel women in Atlanta and sort of the surrounding region are facing? And are there some roles for other municipalities, nonprofit groups, health providers? And what would you like to see the community do?
Oh my goodness. It's I love that question. So when we think about what's happening and what are some of the big challenges, right? So we have HIV and AIDS across the board. I can't separate sexual health and reproductive health simply because one tends to impact the other one. The other pieces that we think about is maternal mortality. We think about the need for campaigns like positive periods, and providing those resources to ensure that women have exactly what they need to have their most optimal reproductive health, right?
Right.
I could go on and on and on and list those topics, but at the end of the day, it's around those social factors that contribute to the disparities and why we need campaigns like BWHIs and other initiatives that are being implemented around the city. And for me, when it comes to finding ways for us to collaborate, I really do want us to focus on a couple of things: increasing access to care across the board. I really want us to address certain levels and issues around education and certain resources. So there are so many resources available, but half of the time people don't know that they're available. And we need to do a better job of that. Last but not least, although we could ask women to educate themselves across the board and, read everything, research things, pick things up, but we need to train our healthcare providers to take a comprehensive, culturally empathetic and sensitive approach to providing care for the women who are seeking their services. And so for me, I could easily work with our team and the mayor to implement programs and policies and initiatives. But when it comes down to women seeking services, if it isn't comparable to their experience, or there's a level of mistrust, or women aren't being believed or prioritized, it's pointless. So for me, that's where the priorities lie. And that's the most important approach that we have to collaborating and creating a very comprehensive level of care and addressing the needs around reproductive health.
Okay, thank you. So we're going to bring Byllye and Shanicia back on to take some questions. And while they're coming back on, Angelica, let me ask this question. The governor has opened the state. Mayor Keisha Lance Bottoms has taken a more measured approach. So, as you're thinking about the health and wellness of the city, what concerns do you have about Black women's health, but women's health in general, as people move back and forth between Atlanta and the rest of the state, since COVID-19 does not stop at the perimeter?
It's so true. There are no lines that say, actually, when I think about where I live, I'm literally on the line between Atlanta and Decatur, and I just happen to live on the line with Atlanta. And my biggest concern, again, I can't say it enough, stay home Atlanta, follow the data, listen to what the data is telling you. And also, if you can, because not everyone has the privilege to stay home, if you can, please do that. But my concern is around people not understanding what resources are available to them, people not understanding exactly what the risks are and potential problems. There are a lot of people who aren't taking it seriously. I know a lot of people who have lost family members during this time and have experienced COVID themselves. And I think we're in a phase where people are beginning to accept the fact that this is a part of our new reality, but we really have to do what we can to safeguard ourselves, and if not ourselves, our loved ones.
Yeah.
That's really important.
Thank you. So we've got a question, and Byllye and Shanicia, I'd like you both to take a stab at this. And the question is, how can we make men feel more comfortable talking about periods?
Well, the first thing is to open up the conversation and say to men, kind of set the stage and say, we're going to have a hard conversation. And it might make you feel a bit uncomfortable, but know that it's really okay for you to feel uncomfortable for a few minutes. But that we need you to look at your attitudes about menstruation and think about how you feel about it, and then understand what that means in a woman's life. Come to understand it. And I remember listening to this man who actually is from Atlanta when we were in Rwanda in November doing a menstruation workshop. And he was there. And he told a wonderful story about how he works with his boys when their mothers get when their mother gets to her period, and say this is a time of the month when your mother needs some special love, some more special love, some more tenderness, some more kindness, and I need you to pay special attention to her during that time, that her cycle is a special thing that's happening to her. And I think by first dealing with their own negative feelings, the men dealing with their own negative feelings and separating from them, unlearning them, if you will, and then become to understand that this brings life.
Yeah,
This is what happens. This is how we function. I mean, and there is no shame, no disgrace. So talk to the men. And I think once men hear women talk about it openly, they get a different understanding of it. I remember when we were at Spelman, talking to the young women there, and the guy, you remember the photographer? We had a male photographer, and the last thing he said is, "I'm going home and have a different conversation with my wife and my daughter." So take the risk and do it.
A teachable moment. Shanicia?
I think I completely agree with everything that Byllye said. And even more so than that, it starts young. For my moms that are watching this that have young boys at home, start to familiarize them early with the conversation of menstrual health. Because when our daughters are in school and they're in middle school and they're starting their periods, you want your son to be the ally. If a young girl unfortunately does bleed on herself, he doesn't need to be the one making fun of her. He needs to understand the importance of protecting womanhood, for one.
Right.
And then also kind of related to what Byllye was saying about intimacy, right? You need to explain to your sons when you have the sex conversation what a period means for a young girl.
Right.
They need to know what that is. So if you are being intimate when you're, 16, 17 years old and you're talking to your sons about this, they need to know that young girl too that they're being intimate with has a period, and a period means that she can get pregnant. And so I feel like it doesn't necessarily have to be a difficult conversation if it's a conversation that's constantly being included. And what I said about opening up the doorway to talk to your children, opening up that vessel of communication. If you do it the right way, no conversation really has to be difficult.
Thank you. We've got time for one last question, and Angelica, this one is for you. And it has to do with cultural competency. The question is around providers and how providers can exercise cultural humility, particularly when Black women and men are dying at higher rates from COVID-19. I mean, there's this mythology that something is going on with Black people. How can we encourage and what can be done to make sure that providers listen to women? We've heard the tragic story of the woman in Brooklyn, the nurse who was turned away twice and died. What can we do to help providers listen to Black women?
It's very unfortunate that I was in a situation literally this morning where I had to be someone else's advocate in order for a provider to truly hear them. And this is a combination of being able to have your own voice, being able to have advocates, understanding what your needs are. But I don't think we have to put the responsibility all on patients. I think it's It's up to providers to also understand what the risks are, what the problems are, and to be able to learn how to communicate with their patients. What's happening a lot, based on the conversations that I've had with various providers, is that they don't understand, one, the historical context of our experience in this country that contributes to all of these factors. And then two, they don't know how to address their own bias. Three, they don't know how to communicate with their patients properly. And so what we're dealing with is not just something that can be completely fixed overnight, but we're talking about system level changes that have to be implemented in order to improve quality of care. So right now, I always love the phrase believe Black women. I would say believe Black people. I think it's so important. And also taking the time to listen. Part of what's happening is that people are really caught up with their mental health and issues around anxiety. That happens for providers as well. We need to address mental health with our providers in addition to that.
Thank you. And so thank you all. I want to thank Byllye for your words. Shanicia, Angelica, thank you for sharing your viewpoint, your expertise. Thank you for trusting and listening to Black women. And I can't express my gratitude enough for all that you've had to offer me and our viewers today. So let me just say, be safe and be well. I want to invite all of you listening to stay tuned and tune in next week for another episode. If you haven't done so already, take a moment, visit our website, coronavirus.bwhi.org, where we'll have some resources and we have information for you to help navigate this pandemic. Usually I take this time to sort of offer a personal opinion, but this time I'd like to actually make an appeal. Over the last few minutes, you've heard us mention the Positive Period campaign a few times and menstrual insecurity. And this campaign is really important to us as an organization because it points to a basic right that all women deserve, no matter what their socioeconomic status. And that's the right to dignity. No woman should have to choose between purchasing menstrual supplies and putting food on the table for herself or her daughters. And as you can imagine, massive layoffs, unemployment, uncertainty about the future because of COVID-19 has significantly increased the needs of the women that we serve. So I want to ask you to consider donating to the Positive Period campaign. On the open market, menstrual cups sell for $33 a piece, but we have a partnership with Freedom Cups that provides a 3-to-1 match. So your donation of $33 will supply 3 women with reusable menstrual cups. This decreases the cost for a woman's period from $10 a month to less than $1. And these reusable cups last for 12 to 15 years. So for a woman with 3 teenage daughters at home who's lost her job, this is nearly a $500 savings just this year. There's a button at the bottom of the screen that will take you to the donation page. You can also contact us after this broadcast for more information on how to work with us, how to partner with us as we support Black women and girls in need across the country. Please help us help women live with dignity. Again, I'm Linda Goler Blount, President and CEO of the Black Women's Health Imperative. Thank you for joining us. And until next week, please be safe.